To meet you all and talk a little bit about a very important thing for all of us that like to spend time in the woods, and that's ticks and Lyme disease. So please interrupt me at any time that we're going through this, and I feel like I have my back to everybody.
You do.
I'm going to turn around a little. Is that
There we go.
Oh, gee, thanks.
I know,
Oh, I don't mind.
okay. All right. So I did pass out a few things just because I had done a PowerPoint presentation up, and then I thought, no, this is not the place for that. Let's just be casual about this and talk. And so I printed off a few things, and I will hold up mine too because I have some other lovely pictures for you. Okay. So we're here to talk about ticks because it's very important to us. So in Nova Scotia, there's 16 different kinds of ticks. 2 of them are the ones that frequently bite people and dogs, and that's the dog ticks and the black-legged ticks, also known as the deer ticks. So I did include a picture of those in case some people aren't familiar with what these 2 different types of ticks look like. So these are the ones that really put out the Lyme and other co-infections to us. But as you know, things are warming up and other ticks are coming up to Canada, to Nova Scotia. They're crossbreeding and they're finding new diseases all the time. So one picture that I didn't include, I don't know if you can see this, but this here is a mother tick. And when she lays eggs, thousands and thousands of eggs is what you end up with. So it's not just a mama having a couple babies and carrying on with her day. She's laying thousands of these creatures out there.
How frequently do they lay?
At least once a year. It depends on the different ticks too. They're different, so there's constant. Just a month or so ago, you could walk in the woods and see tick nests quite a few places. Yeah, they just look like, I don't, but it looks like little black eggs up and down like a vine or something. Yeah, it looks like caviar almost. They're tiny. And you'll just see a pile of them on the forest floor or in the ferns or something like that. You'll definitely be like, what the heck is that? Because you haven't seen something like that. So ticks can carry many other diseases as well. I put a list of some of them here: the anaplasmosis, babesia, Bartonella, Rocky Mountain spotted fever, Powassan virus. And Powassan virus can be transmitted in as little as 15 minutes. So you really have to be careful. I know in the news there's a lot of 24 to 36 hour attachment, and that's just bull. Because if a tick is feeding on a house that's infected with Lyme, yeah, it's already in its saliva. So if it falls off of that host and latches onto you, it can be instant transmission. So you really have to be aware and educate yourself. They talk about the bullseye rash a lot in the news, and a bullseye rash doesn't have to look like a bullseye. A bullseye rash can be anything that looks like a spider bite or bigger. There's a bunch of different diagrams of rashes here, and I'm sorry for the small pictures, but I went to Plan B for this whole PowerPoint presentation thing. Okay. So again, just holler at me if you... We also talked about Bartonella. Bartonella looks like this on people, the rash. It's just like stretch marks. Just looks like stretch marks. Yeah, I know. Then another thing that they're finding, and somebody that my husband works with, his boy was in Keji like a few weeks ago and actually got bit by a tick and ended up with Rocky Mountain spotted fever. Oh, wow. And it's a big rash that looks like hives all over your body. Wow. And it's, you know, it's definitely here. See that, Stan?
Oh, yeah.
Okay. Okay, so the next picture we had there, the Lone Star tick is now in Nova Scotia too. And the Lone Star tick, I put a picture of that in all of these. Has the little yellowy white spot on its back, and it actually will bite you and give you an anaphylactic meat allergy. So it's, you know, then you'll be allergic to pork and red meat and stuff like that. So it's more common, but unless you're treated, yeah.
The damn things are vegans.
Yeah. I think if you started to eat the meat, you would get a rash or hives, and you would start to get a funny feeling in your mouth, like an allergic reaction. Yeah. So what is Lyme disease? It's a serious bacterial infection transmitted by the bite of an infected tick with the bacterium Borrelia burgdorferi. And Lyme disease is the most common tick-borne disease in Canada.
It's also the most
Pardon?
poorly diagnosed disease in Canada, or at least in Nova Scotia.
All through Canada, it's not recognized.
Yeah.
So that's why we got to fight, but we'll get into that a little
Just in
bit.
Nova Scotia.
No, they give you,
Ask any doctor, it doesn't exist.
no, there's an ELISA test, but you have to have 2 positive ELISA tests in Nova Scotia for them to carry on to the Western blot test. However, all of the testing throughout everywhere, and the CDC actually just released this at the end of June, all testing is only like up to 45% accurate, because the bacteria has to lay in your system for a certain period of time for the antibodies to build up to even detect that you have Lyme disease in your body. So it's very important, and we'll talk about that a little bit more, that if you get bit by a tick, you should get some antibiotics into you right away, because you don't know, and the testing, even if it comes back negative, doesn't mean anything. And I have some pamphlets here and some flyers, and one of them is on if you get bit by a tick, and it talks about what you can do and what you should ask for your doctor. And also, if you have a tick and you want to send it for testing, there's a paper here too for Vet Lloyd at Mount Allison University in New Brunswick, where you can send it off, and she actually is doing a lot of testing for Lyme disease and co-infections right now.
She was one of the first in New Brunswick to get bit by a tick,
Yes.
and it took her 4 years before she can convince doctors to even do the damn test.
Yes, yeah, and
Yeah, I
she's
know Vet
really,
Lloyd
really
well.
focused. She's an
Yeah.
amazing, amazing woman. She was part of the federal framework on Lyme disease that just went through and stuff.
I
and-
absolutely refuse to do the test on her.
Yeah, oh yeah, definitely. I've gone into doctors many times and they throw their hands up in the air, and that's why a lot of us will spend lots of money to get tested in the States at different labs and things like that, because the testing is just flawed. So Lyme disease is the fastest growing vector-borne insect transmitted illness in the world. It's found worldwide, everywhere except Antarctica. So there's a map on the Government of Nova Scotia page, and it shows endemic areas in Nova Scotia, and it talks about Yarmouth, Pictou, Lunenburg, Queens, Halifax, and Shelburne. Yeah, but the serious thing is that Lyme disease is everywhere in Nova Scotia. Don't let that map fool you, because Lyme ticks get transmitted by birds and mammals all the time, and they fall off wherever they want. They don't just say, "Oh, I'm in Pictou, I'm getting off now," and it doesn't happen. Yeah. Yeah, so you don't have to be in an endemic area to be bitten by a tick. All of Nova Scotia should be considered endemic. So I got a few more pictures here. I don't know if you guys can see these well, but this is a bird, and it's covered in ticks all over its head.
Poor thing.
And that's the thing, like, birds are carrying ticks all the time, and they're falling off, and you don't need to. I don't know if you guys can see back there or not. You can't see?
In here, in the
Yeah.
dark, we can't.
Oh, sorry, and then this is another bird with ticks all around its eyes. Another thing is, I don't know if any of you are duck hunters or anything like that, but the bottoms of the feet of the ducks, they can be covered in ticks. And
Imagine the horrible discomfort that poor creature's
oh, I know. There's also, they talk about the ghost moose, and the moose are being called that because they're losing their hair so rapidly, and that's because of the number of ticks that are attached to them and biting them, and they're losing their hair. And I do have a picture of a ghost moose, but it's just got, a lot of its hair is missing, a lot of its fur, and it's from ticks. Our wildlife is in serious danger from these. And then again, another picture of deer with them all up around their ears and stuff. They say there was a talk at Dalhousie in June, and we were told that the average deer carries about 400 ticks? About 400 ticks on it.
Get one in Lunenburg, you can triple that.
Yeah, no doubt. And then again, rabbits, the same thing. I'll show you all these. Okay, so transmission time for Lyme disease can start immediate. It doesn't need to be 24 to 36 hours, as we're told in the news. So I don't know if anybody has any questions so far, but just please interrupt me. I don't know how much time we got, and we're just going through this. So proper tick removal. We want to talk about proper tick removal, because you hear people just grabbing it or twist the tick twisters and stuff like that. The best way is to use fine pointed tweezers. Grab the tick as close to the skin as possible, even if you take some of your skin with it, all the better. You can grasp the mouth parts of the tick, but not the body, because if you squeeze the body, you're going to be pushing the toxins into your bloodstream. It'll regurgitate basically and spit right into your bloodstream. So if you do have tick twisters, so instead of twisting the tick, because if you agitate it in any way, just pull it straight up. Use it like a crowbar. Get the tick out of there, kind of
So
thing.
what about those, like the little crowbars you get from the vet?
Yeah, the tick twisters.
Is it
That's
tick?
it
It's
there,
almost
yeah.
like a little crowbar and you put it
Yeah.
under
Yeah.
the head and pull it out?
Yeah, that's fine. Yeah, but if some of them will say to twist the tick until it comes out, don't do that.
You
Just
twist the tip
get it
into
out.
little pieces, I don't care how good you are at it.
Yeah, definitely.
There's
Yeah.
small little parts it's gonna break off.
Yep. So again, grab it as close to your skin. I often take chunks of our skin when I do it because I think all the better. Get it out of there.
No, you're a sadist, that's all.
Yeah. How do you know so well? And straight up. Don't try
Are
to.
you eating my name tag?
Okay. So some of the things that we're also told is to burn the tick with a match or lighter, or suffocate the tick with essential oils or Vaseline. Or to just grab the tick and twist and tug at it. But don't do any of those, please, because it will cause the tick to regurgitate into you. It may back out eventually, but it's going to spit up all of its contents into your bloodstream. Before it does that.
We're advised to douse them with alcohol.
Yeah, and you shouldn't do that because it's going to agitate them and they're going to spit up before they back out of you. Yeah. And I have a bunch of pictures on that, but I think we all can realize what it looks like to put an oil on a tick and twist a tick and stuff like that.
Convertible top.
Yeah. So this just shows somebody pulling a tick out. It's an engorged tick. They're pulling it from the body. They've already started with the bullseye rash on themselves. And you can see a bunch of goo between the bite and the tick. And that's it regurgitating all over the person. So it's not a good
You'd be
thing.
surprised how much will come out of one of them little suckers.
Oh God, they can get huge when
Yeah.
they're fed on you. So tick precautions. So we all spend a lot of time in the woods and doing stuff, so we can take some precautions. Talk about tucking your pants into your socks, wearing boots, spraying your feet and pants with DEET, or wearing clothes that has permethrin. You can buy clothes like that now. Everybody coming in? They say wear light colored clothing so that you can easily see the ticks on you. You know, a white shirt, long sleeve shirt, tuck in your pants. Do regular tick checks on each other because ticks can be the size of a poppy seed and smaller when they're out looking for their first blood meal. So if you're out on a path or in the woods or anywhere, because you don't have to just be in the woods or running around, you can be on a pathway. I had a lady who told me she got a tick on her from being at the Kent Garden Center. So I mean, they're everywhere now.
They won't pass from person to person though, would they?
Well, they could. If they fell off and you were in the same area, they could do that. But they're not going to jump from me to you like a flea mite or something like that. So these are just some pictures showing ticks on people. They fly with birds.
No, but the wife put clothes out on the line and they're 6 feet off of the ground and come in with ticks on the sheets.
Yeah, I think they can jump a little bit, but maybe the sheet hit the ground a little bit or something like that when she was hanging it out. Or
So they're 6 feet, 7 feet
yeah,
there.
yeah. Something that people do too is they carry one of those lint rollers in their car. So after they've been out in the woods or anything like that, they can roll their clothing. And this is just a picture showing. This is a little extreme, but I mean, I don't know. There's some places where you can get this many ticks on you in one
My
day.
backyard.
The bathroom in this park, you could roll when you get that.
Yeah. So after you remove a tick, if you're interested, you can put them in a baggie with a little piece of damp tissue or something like that and send it away for testing. And again, I have a bunch of printouts here if you want to have a copy of that to know where to send it for testing and things like that. Because it's very important that they get their numbers straight because numbers are not accurate on this disease right now.
You're not gonna do
your
anything
place-
about it until it starts costing money.
Yeah.
Is your place in Halifax?
You can send them to Dalhousie. They are doing studies on ticks. They're not specifically looking at Lyme disease right now, but they are looking at different co-infections. I know that Vet Lloyd is specifically looking for Lyme disease and co-infections. But yeah, no, Dalhousie's doing quite a bit, but there's such limited funding with them that they're only doing so many things at a time.
I've seen ticks more than once
Oh.
hanging from a thread, like a spider.
Oh, really?
Yeah, is that a common thing, or did they climb down the spider web?
I'm not sure. Yeah, I'm not sure about that, sorry. I've never seen any hanging like that, but it wouldn't surprise me, you know? I think that they can do whatever they want, you know?
But do they have the spider web capability?
I've never heard of that, no. No, I've heard that they mostly just hang on the grass in the breeze, waiting for someone to come along and hitching a ride type thing. If you,
Probably just coincidence.
yeah, if you graze up against something, they're going to get on
Don't
you
feel
for
good on
sure.
old bald head.
Oh goodness, you were getting clean out there.
Perhaps if they were
So-
on a bird and came off the tree.
Yeah, fell off the bird onto the.
Yeah. Yeah.
But I've seen it more than once.
Yeah, I know, there was a thing I was watching and the hydro workers were saying that it was like they were falling out of the sky, and this was down in Lunenburg County. And they were like, oh, they don't.
Doing silviculture on the power lines. Friday night, he came in, he had 54 on.
Oh my
Oh, yeah.
God.
You know, he comes in, he's got an outdoor shower, just for that reason.
Yeah,
He got 54 freaking ticks on him.
yeah,
And now you've got 15 guys working in a crew, and they're all coming out covered with them.
yes.
You know, where the hell is the prevention?
There's not even signs posted anywhere for people
No.
to be aware, if people are visiting Nova Scotia or anything, to be aware and, you know,
Well, it's what, 8 people died before they even admit Lyme disease was in Nova Scotia?
no, probably. And those are just the ones we know about.
Vet Lloyd nearly died.
Yeah,
Can't hear you?
Vet Lloyd nearly died.
Yeah.
yeah.
4 years, nobody believed her.
What's her name? Walton Cook. They're in Bridgewater.
So if you have had a tick on you and you remove it, try to wash the site as quickly as you can, and then follow up with an antiseptic type thing, over-the-counter antiseptic medication or something like that. And if it becomes swollen or painful, you can apply ice, but you need to get to your doctor or your hospital and demand treatment. And again, I have a pamphlet here, and it talks about if you've been bit by a tick, if you just want to take precautions, or if you get bit by a tick and a rash actually starts, how many antibiotics you should be asking for and what type, because it's a different antibiotic for children than it is for adults. Because children can't take doxycycline.
Don't
And-
take no for an answer.
No, Jesus, no. So Lyme disease should be a clinical diagnosis. And as I said, back at the end of June, the CDC even released a video stating, you can just Google it and put CDC Lyme disease testing, and this video will come up. And they're saying, that the testing is flawed, only maybe up to 40% accurate, and you really need to start getting treatment, because they're recommending that you start antibiotics right away, because you can always stop them.
But that's the problem with trying to get and I know a friend of mine's going through this right now, to try and get your doctor to even give you antibiotics. It's almost impossible.
It is, because they say Lyme disease doesn't exist here. Yeah, and that's the thing a lot of us are fighting for right now.
Wouldn't even give her even a 2-week
No.
trial.
And the funny thing is, they're more than happy to hand over opiates and stuff like that to people. But antibiotics, they think we're all out there trying to get high on them or something like that. I don't know, it doesn't make any sense. So you really have to go in and be firm with your doctors, because otherwise you're just gonna get one pill and sent on your way and told
I'm
to
not
look
gonna do
for
a damn thing until they
things.
start making money on it.
No.
Then everybody will be able to get everything.
So some statistics, and again, those are in the little handout thingies that I put around. So fewer than 50% of patients ever remember being bit by a tick. Ticks, when they bite you, they first put an anesthetic into you, then bite you and feed off of you, so you won't even feel it when you get bit by a tick. And they can feed on you and fall off, and as I said, it can be the size of a poppy seed, and you won't even know that it was ever on you doing anything. You just all of a sudden will start to get migrating joint pains, or flu-like, or dizzy, or you're just not right. You know your own body best. Listen to your own body and demand that a doctor listens to you. And you really have to fight for yourself when it comes to Lyme disease. Typical early symptoms can include fever, headache, fatigue, muscle and joint pain, stiff neck, dizziness, numbness. Most doctors will now diagnose based on a rash, but as I said, fewer than 50% of people ever even get a rash. And it doesn't have to look like a bullseye. It can be, I think in Nova Scotia they say it has to be at least 5 centimeters and be growing on a regular basis, and that's just crazy. So yeah, it is, it's horse shit. Sorry, youngins. So at this time, a Lyme literate doctor or naturopath is your best course of action to diagnose. Unfortunately, there are no Lyme literate medical doctors in all of Nova Scotia. There was one in Cape Breton, Dr. Ben Boucher, but he had his license pulled and his practice shut down because he was helping people with Lyme disease. And that happens all over Canada. Doctors are afraid to treat you because the College of Surgeons and Physicians hasn't allowed them the freedom. There are a couple, there's a doctor in Calgary. Yeah, there's a doctor in Calgary who treats openly, and he has said, and he was at part of the federal framework, that he would talk to any doctor that wanted to talk to him so that they could figure out how to get around the whole College of Physicians and Surgeons, because he's been treating Lyme patients for years and he still is practicing.
Wasn't there supposed to be a gentleman coming from Maine, a doctor from Maine, to help train?
And he also said that he would too, Dr. DeBoyk, I think his name is. I don't say his name properly, unfortunately. But a lot of people from Nova Scotia do travel down to
Yeah, my
him
friend
for
did.
treatment.
Well, she's going in September,
Yeah.
I think, or October.
But it's a shame, you know, I think they spend a couple $1,000s every time they go down to see him, because they gotta go down, transportation, spend the night, all the medicines. And then if you're honest and claim them at the border, they pull them away from you.
Yeah.
Take away from you, yeah.
I think that the testing in the States that she did was about 1,200.
Yeah, I did testing in the States also. Many of my family have Lyme, because it's not just ticks. You can get Lyme other ways, but today we're just talking about ticks, because that's what we're all up against, being in the woods and stuff like
How
that.
serious can tick bugs be?
You can die. It's very serious. You can have a lifetime of debilitation and different things unless you get on a treatment plan.
Okay.
And you have to fight for your life to get on a treatment
Well, I
plan.
can tell you from first-hand experience, you're almost guaranteed you're gonna get a massive infection from it too.
Yeah. And it can sit dormant in your body until something in your immune system has been attacked, and then it can come out and attack you. So you really have to remember, if you've ever been bitten by a tick, even if you don't have any signs or a bullseye rash or anything, down the road it can surface if you were in a car accident or anything like that, something that, you know.
Stays dormant until something wakes it.
Yeah, pardon?
Traumatic.
Yeah, a traumatic
You
experience.
wanna find out you got Lyme disease, go volunteer to give blood.
They don't screen you, because I've had this conversation, they don't screen you for any of the co-infections or Lyme.
I don't know what it is with the antibody or whatever, but I've seen 4 or 5 people from Lunenburg County get refused it.
Really? Oh, well, that's good that they're actually looking at it now, because I donated blood most of my life until I found out I had Lyme disease.
Yeah.
There's no, for lack of a better term, age limit for ticks having Lyme disease? Like, as soon as they're biting, they can have
Yeah,
it?
as soon as they're biting and getting their first blood meal, they can have it, because, you know, maybe their mom was infected, or maybe they started feeding off of a mouse that was infected or something like that, and then they dropped off because you looked a little bit better and they started feeding on you.
Just an ongoing circle.
Yeah.
Maybe that's why I'm
There you go, we'll all dye our hair like you, and we'll be good to go. So if caught immediately, most cases of Lyme disease can be treated successfully with 4 to 6 weeks of antibiotics. Doxycycline for adults, amoxicillin for children. But if not caught early, or if other tick-borne diseases were transmitted, as we talked about, the Powassan, the Babesia, the Bartonella, longer courses of antibiotics are required, and treatments are patient-centered, because there's no 2 people out there that are exactly the same. Everybody has something different. It's such a crazy, crazy disease. All patients respond differently to treatment, so there's so many variables, so you really need to have a doctor that will work with you and listen to you. Even if we just had doctors that you walk in and they listen to you, that would be half the battle right there, because we're told that it's all in our heads, we're crazy, there's nothing wrong with you, because you can get tests done. I've had numerous tests done and everything comes back clear and good, because the Lyme bacteria is like a spirochete. It's a corkscrew, and it can burrow into soft tissue and bone and your brain and hide, and it can actually form a cyst over itself too.
Safe, Rob.
Oh, no, right, okay. I was like, what? If you're being treated with antibiotics, it will actually form a cyst over itself until the danger of it being killed by antibiotics is past, and then it will emerge from its cyst again. So it's a very, very smart bacteria, and it's changing all the time, adapting all the time. So you really need to be aware of your own body and listen to your body. You know, if it's telling you something and you're like, this isn't right, demand to get to the bottom of it.
Can I ask a question? It might seem a ridiculous question, but
None are.
is Lyme disease communicable between consenting adults?
Yes, it is.
Really?
Yeah, and it's also congenital. That's how I got it. I got it from my mom. I have it, my sister has it, her 3 children have it, my 2 children have it, my 2 granddaughters have it, my oldest brother had it, he ended up taking his life. Yeah, it's congenital and sexual. It's Lyme bacteria, the spirochete, is a close cousin to syphilis. They're both spirochetes. They're the only bacteria out there that are. So it is, I mean, so even if, like me, if I'm out in the woods and I get bit, you can get Lyme more than once, even if they cure me one day, which I can go into remission, but it's, you know, sort of cancer that way. You can go into
Stuck with
remission,
it
but you're
on
never
the rest of your
cured.
life.
Yeah. So it can
But
mimic.
after all.
No, Lyme is a great imitator. It can people are misdiagnosed all the time with chronic fatigue, fibromyalgia, MS, lupus, arthritis, Parkinson's, all those different diseases.
But I'm much better now.
Yeah, today you feel good, wait till tomorrow. Ticks carrying disease have been in our province for a long time. As I said, I got it from my mom. She was born in '43. She had a lot of childhood illnesses, so I mean, it's been around for a very long time. Symptoms can mimic all kinds of illnesses, early ALS, Alzheimer's, irritable bowel, bipolar, and you can definitely get Lyme more than once. So if you are one of the lucky ones who gets a tick on you and you get a rash and you get treatment and you get better, which can happen if you're caught immediately, you can still go in the woods next week and get bit again and get Lyme disease all over again. Yeah, exactly. So ticks are everywhere. You got to be aware of that. Do tick checks often. Now I have a couple of pictures here. This one's going to be hard to see, but this young lad, up top eyelid, there's a tick right at the eyelashes. So I mean, it's hard to see, but in this child's eye, up at the top eyelash, there's a tiny little tick up inside here in this child.
There's where I had mine, right there.
Yeah. Now another thing, when we're all out, how many of us have not picked up a blade of grass and put it on our mouth and chewed on it and stuff like that, right?
Ticks had flavor.
Yeah, I know. But they'll get lodged up between your gum and your teeth.
Yeah.
And this again is another picture of a child with a tick up here on its mouth. Up in there.
never going
There's a little
outside.
tick there. So, I mean, I still chew on grass,
I'm
but
going to get a bubble.
yeah, I know, right?
Baby bubble.
So we don't want to forget our loyal furry friends, you know, whether they're for hunting or for family pet. This is showing a dog with a tick in its gum between its
By the
tooth
canine.
there. Yep, by the canine there. Right in there. Burrowed right
right
in.
into your bed.
Yeah. Well, people are finding ticks a lot in their homes now, and that's because their animals are bringing them in their fall. Now, this is a bad picture, but inside their ears, especially beagles and stuff like that spend a lot of time outside with the floppy ears. You got to be checking in their ears. I'm sure you all do anyway if you have them. But they can get infested in there. Also between their toes.
Wow.
Right? This is pretty extreme. But I mean, again, you can Google any of this stuff, these images, and they're pretty nasty.
Kind of scary when you get a grape hanging out of your ears.
Yeah, yeah. So let's do a couple of things here. So we're going to do a true or false. So Lyme disease is a very common infectious disease in Canada and occurs in all the provinces. What do we think?
True.
Yeah, definitely. Lyme disease is in every province in Canada. Yeah. So Lyme disease is the only infection you have to worry about if you're bitten by a tick. That's right. You can get anaplasmosis, babesia, Bartonella, Rocky Mountain spotted fever, which I said my husband's friend's son just recently got that a couple weeks ago. Powassan virus, which they know transmits within 15 minutes, so you have to be very careful. So
You got Bartonella?
Yeah, that's what I was hoping. I got a Bartonella.
one key thing with Bartonella is a lot of foot problems.
That's what you get when Mike bites it.
Yeah.
You'll be
Stay away
told,
from me.
yeah, you'll be told you have plantar fasciitis, but it's actually Bartonella because it attacks your feet. Like you'll be walking on your tiptoes until your tendons will stretch out enough, and then through the day, every time you get up,
Because that's what I've got on
Yeah.
my left foot.
yeah. I used to get out of bed and I'd be on my tiptoes.
Yeah.
And then over time, I'd be able to go down and walk proper, and every morning it was the same thing.
Still, I've had it for like 5 years now.
Yeah, yeah, it could be. I mean, you don't have to have that rash, right? You don't have to have a rash for any of this stuff, it's the other things. So,
Tendons in my feet
Making
seize
heater
up.
heaters?
yeah. So true or
Making
false?
heater heaters?
Tick must be attached for at least 24 to 36 hours. That's
I was gonna
right.
say it's kinda small.
Transmission can start immediately, especially if a tick was recently
me.
feeding from an infected host.
It's a sock.
Yeah. So the best way to remove a tick that is burrowed into your skin is to smother it with petroleum jelly,
Wrong.
grasp it close to the skin with fine point tweezers, and pull straight up. Yeah. Yeah, you don't want to scrape it off with your fingernails. You don't want to do anything to agitate it because, you know, they can regurgitate into you for sure. So you want to grasp it as close to your skin with the tweezers and pull it straight up. So if you're bitten by a tick and infected with Lyme disease, a bullseye rash will appear around the bite within a few days to a week.
Wrong.
Not always, right? Oh, there's a little baby.
There's a beagle.
So of course that's false. Although a rash is considered typical of Lyme disease, many people never develop one. Only 20 to 50% of infected people ever get a rash, and it can take up to 2 weeks to develop that rash. So you really have to be aware, even if you've picked a tick off you and the next day you're like, oh, I'm good to go. In 2 weeks' time you could start to get symptoms or a rash, so you gotta always remember. So if the if the doctor orders a blood test for Lyme disease and it comes back negative, you definitely don't have Lyme disease. False, that's right. The Canadian ELISA, because it's a 2-tiered testing in Canada, in Nova Scotia you have to have 2 positive ELISAs before they move you on to the second part, and that's only 40% accurate. So people are misdiagnosed and mistreated all the time that have Lyme disease, so you really need to get in. Our testing only tests for 2 strains. There's like 100 strains. So that's why it misses a lot of false negatives there. So conclusion, disease-carrying ticks can now be found all throughout Nova Scotia. Our testing is flawed. A negative ELISA does not necessarily mean you don't have Lyme. There are many reasons for a negative test. If you have been bitten by a tick, demand antibiotics, demand treatment, at least 28 days worth. Fast treatment is the key. And that's all I got for you. Thank you very much.